The OCTA Research Group reports a higher COVID-19 death rate in Metro Manila compared to some months ago. Let's talk about this more with research fellow Professor Guido David. Sir, good evening.
Yes, hi, good evening, Rita.
Sir, what exactly are the numbers, and do we know the demographics of these recent deaths?
Yes, actually, we do, Riza. What we're seeing is that the case fatality rate has actually increased in NCR. As of October, it was around 1.8%. And as of yesterday, it was up to around 2.02%. So there's a slight increase, and this is in NCR. And well, of course, what we're seeing is that the demographic age group from 65 and above are dying at a 12% clip, and then for the seniors from 60 to 64, they are dying at a 6% clip. But it's much lower, of course, for people aged 0 to 17 and 18 to 54. It's less than 1% for those groups.
Sir, OCTA also reported that a reproduction rate in NCR has slightly decreased. How big of a decrease in number are we talking about? And is this significantly enough to indicate a downward trend in infections?
The decrease in the reproduction number is actually significant. At the start of the ECQ, it was 1.88 before the ECQ, and as of yesterday, it's 1.23. This is a significant decrease, and that's pushing the momentum of the virus down. However, it doesn't mean that the numbers are already on a downward trend. In fact, they're still slightly increasing overall, although there are already several LGUs in Metro Manila which are on a downward trend. That includes Pasay, Marikina, and I think Mandaluyong. Some LGUs are having a negative growth rate, a one-week growth rate, but this does not guarantee that it's on a downward trend, because it just means that the numbers this week are lower compared to last week. But because the decrease is very slight, it could be due to the effects of delayed testing or reduced testing during the holidays.
Sir, the group also reported that the number of tests in the past week is lower than the average prior to ECQ. How do you think this affects the figures?
Well, it affects the figures because it skews the numbers in a way, because we're seeing, there are days when we're seeing low numbers like 6, 7, 8,000, and then there are days when we're seeing higher numbers due to the testing delays and the backlog. So we're seeing 11,000 cases. We saw that yesterday and today. We're expecting a decrease in numbers tomorrow and Wednesday. This is natural. Also, the testing has basically resumed to capacity. So we're testing close to 30,000 for the past few days. So in terms of, well, we had those backlogs, but I think we're clearing them up now. And we're really getting the clearer picture now. And hopefully by the end of the week, we're projecting that by the end of the week or by next week, our reproduction number will be less than 1. That means we will be possibly on a downward trend already.
Sir, what do you think is needed for us to go back to the 1,000 to 2,000 daily cases like before?
Fortunately, Risa, it will take some time before we get to those numbers. Even when we get to a downward trend, starting from 10,000 cases, it will take us at least maybe 2 or 3 months to get to to 1,000 to 2,000 cases like what we were seeing before. Right now, the good news is that the NCR has slowed down the pandemic, but the bad news is that it's still increasing in some regions outside the NCR, and hopefully the quarantine classifications will help curb the increase in these areas.
Sir Guido, over the weekend we had infectious disease expert Dr. Ronchin Solantes saying the shift of the NCR Plus to MECQ is premature. Do you agree?
Well, part of our recommendation was we could shift to an MECQ, and we actually supported the shift to MECQ. For one thing, the reproduction number is already close to 1, so we think that it will not take much to get the reproduction number to less than 1. Having said that, we have read the specifications of the MECQ, and it's actually a lot less restrictive than we expected. And we are in the process of calibrating our recommendations regarding the MECQ because, in a way, this is the MECQ that we're getting is not quite what we were expecting.
So how do you think, sir, this MECQ will impact the overall COVID-19 trend, and what are your current projections given the presence of more variants and other factors?
Well, the variants are really a concern. Hopefully, the MECQ will still be enough to slow down the trend. We did see that during the GCQ bubble, it was slowing down the trend somewhat, but the ECQ was more effective in reducing the reproduction number. But if we imagine that we're returning to something close to a GCQ bubble that we had 2 weeks ago, then it will still cause the reproduction number to decrease, but it will happen more slowly. If that happens, it could take us maybe 2 weeks or even 3 weeks to get the reproduction number to less than 1. We're hoping it will do it faster than that. Currently, we don't have projections yet. We're still examining the specifications of the new MECQ, but more or less our estimate is what I said. We're expecting maybe in 2 weeks that the reproduction number will go below 1. When that happens, the cases will stabilize and start on a downward trend. So it means that we'll still be seeing big numbers like 10, 11,000 cases per day for the next 2 weeks.
Sir Guido, you mentioned that outside NCR, you're seeing also upticks in other provinces. What are these areas, and are there hotspots other than Metro Manila as of today?
Well, the main hotspot outside NCR Plus, of course, we're also seeing increases in Batangas and Pampanga, but the main hotspot would be in Santiago, in Isabela. Benguet is also fairly hot because of high hospital occupancy and a high positivity rate. So there are some areas, but we're also seeing upticks in several regions, even in the Ilocos region, in La Union, for example, even in the Bicol regions. But these upticks are at a lower scale, so they're not really concerning yet. We're just noticing that there are upticks that are starting to happen in other places, and hopefully they can curb these upticks before they become full-blown outbreaks.
Sir, but as the restrictions are eased, mobility is expected to increase. What are your suggestions for activities with high foot traffic, such as ayuda distribution?
Oh, well, ayuda distribution is problematic because it could be a super spreader event, and we have seen already some instances where the ayuda distribution, involved a lot of people clustering in places. And part of our recommendation is to review the ayuda system. I think some LGUs are doing it, are distributing it, by going house to house. I don't know if that is possible with other LGUs. We don't know the limitations of each LGU, so we cannot really comment as a whole, but I think the LGUs should definitely examine the process by which they distribute ayuda.
As always, thank you, sir, for your time and for your insights. That's Professor Guido David of the OCTA Research Group.